Good morning. My name is Bariah and I'm from Malaysia. I'm here to present our work on the association between the peripheral eye length and refraction in myopic children wearing DIMS lenses for 12 months. And I have no financial disclosure. And also this project is funded by our university grant, which is GUP 2020-054. As you know, the prevalence of myopia has increased drastically in recent decades around the world, particularly in Asia, and the risk of myopia complications, such as retinal detachment and myopic maculopathy, as well as the economic and healthcare burden have motivated researchers to explore treatments and to reduce the risk of onset and the rate of myopia progression. Few current myopia management strategies are established on treating the peripheral retina using optical defocus, and it is well known that myopic eyes are associated with hyperopic relative peripheral refraction and a more prolate overall eye shape than hyperopic eyes. But the role of hyperopic defocus remains controversial due to contradicting results from previous investigations. Nevertheless, several optical lenses, such as the DIMS lens, were developed based on the theory and showed to be effective in slowing down myopia progression and axial length elongation. The purpose of the study was to determine changes in the peripheral retinal influenced by the progression of myopia in children wearing DIMS lenses for 12 months, and the results were compared with single vision spectacle wearers. This is a randomized clinical trial at a single site. MRI measurements were conducted to measure the peripheral eye length at the radiology department in the university hospital, and we conducted cycloprogyl refraction using 1% cyclopentylate hydrochloride and autorefractometer at central and peripheral parts of the cornea with 10 degrees interval up to 30 degree nasal and temporal. And the myopic Malay children with age between 8 to 9 years and spherical equivalent refractive error between -0.75 to -4, or with a VA of 6.6 or better in each eye were invited to participate in the study. This is our results. We managed to get 38 number of subjects. 20 was prescribed with DIMS lenses and 18 were prescribed with single vision. And the results showed that 63% of less increment in refraction and 65% less increment in axial length elongation with DIMS lens wearers. And the results also showed that the relative peripheral refraction in single vision wearers was significantly more hyperopic at 12 months than at baseline, whereas in the DIMS wearers, the RPR was significantly less hyperopic at 12 months than at baseline. This is the result of our peripheral eye length using MRI. The result shows that the elongation in axial length and PEL with myopia progression leads to steepening of the retina. This is the results of the single vision lens, whereas the peripheral eye length in DIMS lens showed no significant elongation in axial length with myopia progression, and the axial length elongation is less than the peripheral eye length, which leads to flattening of the retina. We also conducted a correlation analysis between the peripheral refraction and the peripheral eye length, and from the results, as you can see, there is no significant correlation between both parameters except at 30 degrees temporal. This study concludes that wearing DIMS lens alters eyeball shape, reduces myopia and axial length elongation, and retards myopia progression. It appears that as myopia progresses in DIMS lens wearers, the PEL increased by a greater amount than the axial length did. Thus, the retina was reshaped to become increasingly oblate and to display peripheral myopic defocus. Nevertheless, there is no clear association between changes in peripheral refraction and myopia progression, which is probably due to the short follow-up period in this study. Therefore, more data is needed to confirm our hypothesis. Thank you.